Good afternoon and thank you for joining us. My name is Tina Tebow and I will be your moderator for today's press briefing. Joining us today, the Honourable Ian Rankin, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Good afternoon, everyone. I wish I had some good news to share today, but our cases continue to climb. 66 today, with the majority in the central zone, the Halifax and surrounding communities. We have 5 people in hospital, including someone in their 20s in the ICU in Halifax. This is a wake-up call to our younger population. You are not invincible, and you need to take this virus and the variants seriously. For those who have been diagnosed with COVID at home or in the hospital struggling with this disease, our thoughts are with you and your families, and we wish you a speedy recovery. The virus is on the move in the Halifax Regional Municipality. We have community spread, and we need to do all we can to slow it down. Today we're closing all the schools in the Halifax Regional Centre for Education and the area that is under the order for the next 2 weeks. We have a number of teachers and staff either diagnosed with COVID or isolating because of close contacts. This closure will give all those affected enough time to isolate. It will give our custodians time to do a deep clean. And it will give our Halifax communities the chance to reduce their movement and the spread of COVID. We're also looking at our Cape Breton schools. There are currently 3 schools with reported cases of COVID. None of our students have tested positive. At this point, there is no known community spread. But I want to assure all parents and teachers and staff and students that we are watching this very carefully. We have added testing sites in the community, and we encourage everyone to get tested, including students. I know you're worried in Cape Breton, but please know we are monitoring to see what happens, and we will act swiftly when required. COVID is back, and it wants to stay. That's why we have to limit our movement and try to outsmart this deadly virus. We've already asked you to stay within your community unless you have to leave for essential purposes, for work, for daycare, for medical appointments or legal appointments. We've also reduced our gathering numbers. It's down to 5 now in the Halifax area and 10 outside of Halifax everywhere else. We may need to move down, and we'll see how this goes as it is. Today we're announcing a number of other areas where we want to reduce numbers, from sports and culture to faith-based gatherings. Dr. Strang will give you the details, but I want to talk to you about how important it is to follow these restrictions. It's not fun to practice and not play, to perform on Zoom and stand in front of a large audience. But we are taking all the necessary precautions for your protection. Today, we're opening up more vaccine appointments for those over the age of 55. Joining the AstraZeneca, we now are offering Pfizer and Moderna. This is a large group, and we're hoping with all 3 vaccines being offered that we'll be able to get more and more shots into arms. And Dr. Strang, as we continue our vaccine rollout and limit our movement and gatherings, the less likely COVID-19 will stick around. Over to you.
Thank you, Premier. Good afternoon, everybody. Another record-breaking day for cases, and while this is not unexpected, this is not what any of us want to see. At this point, we're not seeing community spread outside of Greater Halifax, but we are seeing connections between the cases in other zones, 2 cases in Central Zone. And with the rising cases and these connections, my concern is also rising. We said yesterday that the increase in COVID cases is not just a Halifax problem. We are a small province with a lot of interprovincial travel. We need everyone to slow down, stay close to home, and take this seriously, from Yarmouth to Amherst to Sydney. It would not take much for cases to increase outside of Central Zone if people are just going about their lives as if COVID is only in Halifax. So putting restrictions in place across the province is necessary to give us added protection. If the virus does spread, these measures will minimize its ability to take hold and spread within another community. We are targeting the activities with our restrictions that have the highest risk and are asking people to make their careful and safe choices about these activities. For all we're doing in our lives, ask yourself, is this necessary? Is it essential? And if it's not, don't do it and just stay home. There is no change to the restrictions already announced and in place for Halifax and the adjacent communities. The restrictions I am about to outline apply to the rest of the province, and they will be in effect as of 8 a.m. tomorrow. The household gathering limit is back to a total of 10 rather than household plus 10, but a larger family can still live together and be together when they are out in the community. There are to be no social events, special events, festivals, arts and cultural events, sports events, wedding receptions, or funeral visitation or receptions. Faith gatherings are reduced to 25% of indoor capacity to a maximum of 100, and with the required distancing and masking. Wedding and funeral ceremonies hosted by a recognized business or organization can have 10 people plus the officiants. Any meetings and training hosted by a recognized business or organization can have a maximum of 25 people with physical distancing and masks. There can be no games, competitions, or tournaments in sports or in-person arts or cultural performances. And there can be a maximum of 10 people indoors and 25 people outdoors to practice, train, or rehearse. Virtual gatherings and performances can be held, but with a maximum of 25 people with the necessary distancing in a single location. Restaurants and licensed establishments, Casino Nova Scotia in Sydney, any operation with a VLT, and First Nations gaming establishments can operate, but with 50% capacity, and they can provide food and beverage service until 11 p.m. and need to close at 12. Licensed and unlicensed establishments and organized clubs can operate at 50% capacity to host activities such as darts, cards, pool, and bowling. Retail businesses and malls can operate at 50% capacity. Personal services establishments, such as hair salons, barbershops, and spas, can operate but cannot provide any services that require the client to remove a mask. Indoor fitness facilities like gyms and yoga studios, and sport and recreational facilities like pools and arenas, indoor tennis courts, can operate at 50% capacity. Outdoor fitness and recreation run by businesses and organized clubs can operate with a maximum of 25 people and, again, physical distancing. Businesses and organizations offering a wide variety of recreational activities such as indoor play areas, arcades, climbing facilities, dance classes, and music lessons, again, can operate but at 50% of their capacity. The same for museums and libraries. They can open but at 50% capacity. We are also extending the workplace masking policy to be province-wide. So in private indoor workplaces, such as offices or warehouses, masks need to be worn in all common areas, places where there is an interaction with the public, areas with poor ventilation, and areas where distance between employees cannot be maintained. And that is province-wide now. And finally, effective immediately, all recreational activities between schools, whether it be sports, music, or other clubs, as well as field trips into the community from a school, have been stopped. I know this is hard, but please believe me, if we buckle down and work together and do what needs to be done, we can turn this difficult situation around. So there's been a lot of information coming at people, and I'd like to just add some points of clarification as things we've implemented over the last few days. We're asking lots of people to go get tested. But if you're booking a test, we need to book it within your own community. You can no longer travel outside of your community to get a COVID test. And if that means you have to wait for a little bit, please do so. That's part of having everybody stick as close to home as possible. So go to your closest testing center. If you have an appointment to get your vaccine, we would like you to reschedule that if you're in any of the following circumstances. If you have been tested and are positive for COVID, and you're still considered an active case. If you're feeling unwell and have symptoms, even a mild symptom, don't go to get your vaccine, but go schedule a test. And if you have been directed to self-isolate by public health because you're a close contact, or if you have been at one of the exposure sites that public health produces notifications on, then again, you have to go get a test rather than going to get a vaccine. If you have been advised by public health or at a low risk notification site, you will be told that you need to get a test, but not self-isolate. So if you're in that group, you can still, and you're still feeling well and have no symptoms, you can still go get your vaccine. If you only need to isolate until you get test results, then you can rebook your vaccine appointment after your test is negative. And if you've been told to isolate for 14 days, regardless of test results, then you'll have to wait for that 14-day period to rebook your vaccine. And to rebook your vaccine appointment, you do it the same way that you did your initial appointment, via the online booking platform or by calling the toll-free line. And people are well aware that we'll have more people looking to reschedule their appointment, and we're prepared for that. It's critical that we ensure the integrity of our vaccine program and our vaccine sites. So please, if you're in any way required to be isolating because of COVID, or even including if you're waiting for a test result, do not go through to get your vaccine, but rebook your vaccine when you can. And I've heard many people say that they aren't worried about COVID. They believe if they're young and healthy that COVID is something that happens to someone else, or that if they get it, it'll be like having the flu. While it's true that older people and those with underlying conditions are more severely impacted, COVID-19 can have devastating effects for anyone, and the variants do not discriminate by age. We have seen this across the country, this third wave, significant increase in young people with severe illness and hospitalization in ICUs. And for the first time, Nova Scotia has somebody in their 20s with COVID who is in an ICU. I don't say this to scare people, but to let this to be, if you need one, another wake-up call. If you're still being careless about your COVID protocols, now is the time to get serious. As I said yesterday, now is the time we need each of us to be at our best. So for the next 4 weeks, I'm asking you to roar back at this virus by hunkering down close to home as much as possible. Reduce your contact with other people. Get tested, especially if you're feeling unwell or have been at an exposure site or been directed by public health, and get your vaccine when it's your turn. Tina.
Thanks, Dr. Strang. Just a reminder, we'll take one question and one follow-up from reporters on the line in the allotted time we have for today. Again, there are quite a few reporters on the line, so please try to keep your questions short and as brief as possible, and we'll try to get through as many questions as we can. We'll start with Shayna Luck from CBC. Go ahead, Shayna.
Thank you. Premier, we're hearing you say to people to stay in their community. I want to know exactly how this is going to be enforced. Is your expectation that this will be complaint-driven, or is it your expectation that police will enforce this in some other way? And if so, what does that look like?
So what we're focused on is the cooperation of Nova Scotians. We asked in previous waves to stay at home, and when possible, if you're going out to a park, or something like that of that nature, that you stay within your community. It's not as much of an emphasis on enforcement, but if there is egregious disrespect for that order that will be signed this week through the Emergency Measures Act, we won't hesitate to make sure that we have that in place. But by and large, I do believe Nova Scotians will listen. That's been the case in the past. And we have lots of parks within our own communities. We have the order in Halifax. This was about trying to stop the spread not only in Halifax but in communities across the province. We shouldn't be traveling from one end of the province to the other, or leaving your municipality to go get exercise unless it's essential.
Go ahead, Shayna, with your follow-up.
Thank you. My second question is for both the Premier and Dr. Strang. Some are calling for paid sick days so essential workers can stay home if they're sick. Premier, are you prepared to make that move? And Dr. Strang, what do we know about the effect of paid sick days from a public health point of view? What difference do they make?
Well, if you're sick, you should definitely stay home. We've said that if you have any mild symptoms, stay home, and we're asking people to go get tested even if they're not sick. There are supports in place. The federal government has a specific sick benefit in place if people are staying home and missing work because of it. And I'd ask all employers, businesses to understand if somebody is not able to make it to work. Many of the businesses are closed anyway, but if you're sick, stay home.
And just from a public health perspective, anything we can do to support people who are, it's necessary for them or their families to be with a period of quarantine or isolation if they're sick. Whatever the more they can get support, the better. We actually have actively in wave one, and we're using it again now that when public health becomes aware of families that need supports, we're working with colleagues across government to bring both financial and housing support, if necessary, to support cases of either isolation or quarantine.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Dr. Strang, I want to ask you about this decision to close schools. We had the advisory committee coming out today saying that if at all possible, keep children and teenagers in schools. What ultimately clinched the decision for you?
So it's and I fully agree. I know the pediatric advisory group well, fully support their position that, and we've said this all along, keeping kids in school is one of our key priorities in our COVID response, but also recognizing there may be times when you can no longer do that. And it's a combination of factors of having significant impacts on our school system. A lot of the communities in Halifax Regional Centre for Education, there's a significant amount of virus activity, and we are seeing cases in people in schools where they're infected from the community. It's also creating significant staffing pressures with many people off because they're waiting for a test result, or if they're a contact of a known case. It's creating significant staffing and operational issues which impact the ability to run schools safely. So the decision was made collectively at this point to close the schools, the Halifax Regional Centre for Education, but there are especially in the Hants corridor, the East Hants Rural High family of schools is also part of the affected areas that we're talking about, and that family of schools has been closed as well.
Go ahead, Keith, with your follow-up.
Yes, and back to vaccines. It's my understanding that nurses at provincial jails have been vaccinated. Jail guards have not, and obviously none of the inmates. We have advocacy groups coming out today saying that it is a population at risk, and they say that outbreaks started in jails could spread to the wider population. Where do we stand with that, and will you deviate in any way from what you've already committed to in terms of the age-based approach?
Plans in place. Information is already going out to our correctional staff and getting them into one of the many community locations with a priority access. So that's already been communicated to them. They need to step forward and get vaccinated. We're within probably the next week. We're going to be in and providing vaccine in the correctional facilities. We're also looking at ways, and many people in our correctional facilities are there for short periods of time. They often come in and out on weekends on remand. So we're looking at ways about how on an ongoing basis we immunize those people as they're in the facilities on remand.
Next, we'll go to Elizabeth McSheffrey from Global. Go ahead, Elizabeth.
Hi there. First question is for Dr. Strang. Just wanted to know a little more about the return to school date information. We're expecting next Friday. That's about 2 weeks from now. Is it possible that at that time you might announce that schools would remain closed for a longer period? Depending on the epidemiology, is it possible that they'll stay closed after that?
So everything we do always is not carved in stone. We announce dates, and we expect that that's our target for 2 weeks. But like everything, we always watch the epidemiology, and sometimes we may need to extend if necessary.
Go ahead, Elizabeth, with your follow-up.
Next question is regarding vaccines. NACI's recommendation is that it can be used on adults as young as 30, and I know you've said previously that's based on epidemiology and risk for COVID-19, but given that we have AstraZeneca that could potentially go unused, and we're assuming all cases now are variant cases, I'm wondering why not give the option to younger people to get AstraZeneca?
We still have for 55 to 64 both options. We're still getting demand for AstraZeneca vaccine. The reality is we have only a relatively small amount of AstraZeneca vaccine that is unused at this point in time. We're going to continue to roll out our vaccine program, continue to stay with that age group for AstraZeneca. We're now opening up the mRNA vaccines, Pfizer, that we have mostly in the community for people 55 to 64.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Premier and Dr. Strang, I'm just wondering whether or not you think these restrictions go far enough, especially when it comes to enforcement and the increase in fines that was announced yesterday for people who aren't following public health orders.
You want me to answer?
You can start, yeah.
Yeah, I mean, time will tell. We put some pretty strong measures in place. We're not very far off what was used in St. John's and in Edmundston, but there are a few areas if we need to go further. But we only put them in place on Friday. As I've said before, that we need to give some time due to the nature of the virus, the incubation period. What we're seeing in the last few days is a result of people's activities a week ago, well before we put restrictions in place. So it'll be towards the end of the week before we can say what we're doing is not enough. And in terms of enforcement, we certainly need to have an enforcement component. We've certainly strengthened the message around how serious we are on that with increasing fines. But at the end of the day, much of this is not about enforcement. It's about every Nova Scotian doing what they need to do. And so if we have to rely on enforcement to force people to do things, we're in a very serious situation, and that will not control COVID. What will control COVID is everybody stepping on them and doing what they have to do without having to have the strong arm of the law forcing them to do it. I trust all Nova Scotians have, by and large, over the last year, shown that they don't need enforcement. They know what they need to do, and they'll do it to keep each other safe. But now we need to be even more clear and stronger about looking after each other without having to worry about whether we're going to be penalized or not.
Yeah, and I agree with what has worked so far. Is Nova Scotians, to their credit, have by and large listened to the public health protocols. We'll continue to make sure we have the appropriate protocols in place based on what we're seeing out there, and we won't hesitate. I want to assure all Nova Scotians that if we need to take further action, if public health sees activity, if we need to take action outside of Halifax, then we'll do so. But we're really working hard to make sure that we're working. And I do see cooperation when you see lines getting tested. That's helping us identify cases, tracking cases. But we shouldn't be as focused on, as Dr. Strang would say, on what other people are doing. Everybody has a part to play, and we're confident that these are the appropriate measures right now.
Go ahead, Natasha, with your follow-up.
Thank you. We've heard yesterday and today, both of you referenced people staying in their local areas. We're hearing from some people who are confused by the exact definition of local areas. Does that mean counties, neighborhoods? If you're on the Dartmouth side of the harbour versus the Halifax side, could you just clear that up for people?
So I think, again, this is, I have always used the term, part of my 3 C's, common sense. Stay in your local community. How you define your community, you know what your community is. We know some people have to travel for work, but we're asking as many people as possible and employees to cooperate to let people stay home. Certainly in the Halifax area, starting tomorrow, we won't have kids in school. People need to do essential shopping and do that as close to home as possible. You can get out and be active with your family group or your close social group. It's important to be out in the sunshine and get some physical activity, but do that close to home. Now's not the time to get in your car and drive for an hour and a half to go for a hike somewhere. We have lots of nature around us in our local communities. But use your common sense, how you define community. I don't think we should have to actually take a map and draw a line for everybody about what your community is. People can figure this out using their common sense.
Next, we'll go to Nabal Snan from the Chronicle Herald. Go ahead, Nabal.
Good afternoon. Dr. Strang, I was wondering if you can give us an update on the vaccination efforts for people in independent living and unlicensed long-term care.
I don't have I have not had a chance to get updated in detail. I know that we are through April. We are working with all those. We're finishing off second dose in our licensed long-term care facilities. We're working with a lot of the private seniors residential homes and also other residential facilities with adults with disabilities. But I don't have a detailed update I can provide at this time.
Go ahead with your follow-up, Nabal.
Thank you. This is also for Dr. Strang. I was wondering if Nova Scotia is considering adding pregnant women to the COVID vaccine priority group. We've seen that happen in other parts of the country.
We're not. We're sticking with our age-based approach. I get lots of questions from all sorts of groups, but the reality is we are now in a absolutely critical race between vaccination and the variant viruses. We have shown in the last couple of weeks the success and the rapid speed of how we're starting to deliver vaccine with an age-based approach. That we're within 2 to 3 weeks we're going to be into 40-year-olds. So all of these groups are looking for their conditions. And I understand their concern, but to try to figure out a way to accommodate them takes us off target at a critical time where we absolutely need to stay focused on the fastest way to get vaccine to as many people as possible. And each of those people with certain conditions, they are being protected by others around them getting immunized as fast as possible.
Next, we'll go to André Blanc, Radio-Canada.
Bonjour, ma question est pour Monsieur le Premier ministre. Je voulais savoir pourquoi il a été décidé exactement de fermer les écoles quand on sait qu'elles ne sont pas le lieu premier de transmission du virus.
Thank you for the question. The question was what was the decision around closing schools? And again, this is where we're working alongside public health very closely in monitoring cases. We do have the back to school plan that's a flexible approach. We don't have to use a blanket approach across the whole province. So the issue of community spread is within our Halifax communities where we've shut down travel in and out. But we're going beyond just 1 or 2 families of schools. This is impacting a lot of staff, support staff, and ensuring that we have a chance to do deep cleaning across. This is about being proactive in this community, and we're watching very closely in the other parts of the province.
Go ahead, Adrian, with your follow-up.
Et quels sont les critères pour que les écoles rouvrent dans 2 semaines?
Yeah, there's no strict criteria with that. Respectfully, we need to. Everything changes day to day with COVID. So Dr. Strang and I are talking daily about the circumstances behind if there is spread, if we know where the cases are coming from. So we'll have to evaluate as we get closer to the 2 weeks, and then we'll adapt. And if it's safe to open up, then we'll do that. But we're always siding on the side of caution, I can rest assure you.
Next, we'll go to Rebecca Brown from allnovascotia.com. Go ahead, Rebecca.
Hi, this question is for Dr. Strang. You're asking people to stay in their community and get tested. So I'm wondering if there are plans to expand the rapid test sites.
We're certainly looking at how both on our the primary assessment centers using the PCR test. We're use the example of up in Cape Breton. We've expanded and have both the primary assessment center using the PCR test now at the Member 2 Health and Wellness Center, and we have rapid pop-up tests using at CBU as well. And we're actively looking at how we expand, especially that rapid pop-up test. I think it's important. I need to remind people that we have different streams of testing for different purposes. The pop-up test using that rapid test, those are for our lowest risk people who have no symptoms whatsoever. If people have any symptoms, they're feeling unwell in any way, or they're been identified as a contact of a case, or they say, they read an exposure notification and they meet the criteria there. All of those are at higher risk, and they need to go to one of our PACs. It's important that people understand that, and so we have to balance about the most important thing is to get people at the higher risk tested, and we've expanded. We're now up to the ability to do, I think, about 15,000 tests a day, collecting those specimens, and the lab is working hard to catch up. And we're also looking at how we, build capacity for the rapid pop-up using the rapid tests. But again, we need to build capacity in multiple streams for multiple purposes.
Rebecca, go ahead with your follow-up.
Yes, I was wondering what percentage of asymptomatic tests are turning up positive?
We've had a few, but a very, very low percent. Our percent positivity at our PACs, which are a higher likelihood, again, as I just explained, is about 0.7%. I haven't got an update today on the number of cases. We've had a handful of cases in single digits from the thousands of tests that we've done in the last few days at our pop-up sites.
Next, we'll go to Greg Mercer from the Globe and Mail. Go ahead.
Thank you. It's a question for Dr. Strang. It's about airports, and I'm just wondering how confident you are that screening processes at airports have been effective in keeping the virus out of the province, and why rapid testing is not being used for all travelers coming into that airport.
So we've been through this a lot. I mean, the most important thing that controls the entry of virus is not testing, it's quarantining. And we've had robust quarantining for months about people coming into the province. You can supplement that by testing, but people need to understand that just because somebody is negative upon entry does not at all mean that they couldn't turn positive. So we've quarantined as the first most important step. We are virtually all travelers who are coming in are being tested. They may not just be tested at the airport. Having said that, we are actively working with the airport around how we might use rapid testing of travelers. We've in good conversations with them. We've got some solutions that just need some final steps. The reality is that the testing strategy, all the people who are working virtually 24 hours a day for the last week on this have been taken off task of that work to deal with our current surge in Halifax.
Go ahead with your follow-up.
It's just about concerns you might have about people with seasonal properties, cottages, coming into the province and seeing Nova Scotia as a place to ride out the pandemic, leaving regions with higher case numbers. Are you concerned about that trend?
So that is I am concerned about that. Is exactly why we announced last Tuesday only essential travelers can come into Nova Scotia. And as part of that, we said people coming here for seasonal travel cannot come at least until May the 20th. And if we have to push that date out, we will. We've already turned a number of people away at the border who had no reason to be a non-essential reason for coming into Nova Scotia, and we're turning them away.
Next, we'll go to Jake Boudreau from the Port Hawkesbury Reporter. Jake, are you there?
Yes, I am.
All right, go ahead, Jake.
My question is for Dr. Strang. On the 23rd was an advisory issued about the Port Hawkesbury Civic Centre, and part of that was that anyone there had to isolate. But then the next morning that was changed, and the requirement was that people have to get tested. I'm just wondering what happened there, why there was a change.
So that's simply because over a short period of time, we became aware of several more cases that occurred at that hockey tournament, the specific dates and times, and so we increased the category. When we've had an exposure, we always put it into low, medium, high. That's the work of public health, and based on that, we give certain advice for people what actions people should take when they've been there. So as we got more information, more cases, we increased that and put that into a high-risk exposure, which now means that we're saying anybody, and it was at certain times on April 17th and 18th, anybody who was at hockey games at the Member 2 Arena on those dates now needs to be isolate or quarantining themselves, other than to go get a test, and then they have to stay quarantined until May the 2nd, which is the end of the 14 days after their exposure. I'm just going to take a moment. I just want to clarify. They're just being handed a note, but there seems to be a lot of, when we talk about people staying in their community to get tested, it really means stay in your community, and certainly in HRM, it means do not drive to Truro to get a test. So if you live on the Dartmouth side, get a test on the Dartmouth side. If you live in Halifax, get a test in Halifax. Get tested in your local community as part of staying close to home.
Thanks, Dr. Strang. Jake, do you have a follow-up?
My question was actually in regards to the Provincial Civic Center, not the Member 2 Center. I don't know if I wasn't clear about that.
Sorry, I'm not aware of the details of that. I mean, we have elevated the alert on the one I've been involved in is on the Member 2 one. That's the one that's most concerning. I don't believe there's a major concern about the event that happened in the Port Hawkesbury Arena. I'm sorry, my head's in 100 places today.
Next, we'll go to Chelsea Gould from the Truro Daily News. Go ahead, Chelsea.
Hello, my question is for both the Premier and Dr. Strang. If business owners in other regions of the province find people from HRM shopping in their stores, do you want them to be reported, and if so, how?
So I think it certainly would be reasonable for store owners if they become aware of somebody shopping. It's like we've done with masking. Put up some signs that say this store is for people shopping from in this community. And if you're from outside, please don't come in. If you become aware of somebody, say if you're a store in Truro and there's somebody there that doesn't listen to that, is from Halifax, then certainly you can reach out to local law enforcement for assistance.
Go ahead, Chelsea, with your follow-up.
Thank you. Dr. Strang, last Thursday it was announced that low-risk exposure sites in Central Zone were no longer being listed. Has this now become the case for other zones? I'm specifically thinking of a business in Truro that closed for deep cleaning but did not get listed.
I can't say why that wasn't listed. It's only in Central Zone we're doing this. I think it's important for people to understand those low-risk exposures. We're asking people to go the only response would be to go get tested. They don't have to isolate, which is a general message for everybody, especially in the Halifax area. I think it's important for people to understand that the extent of spread we have in the Halifax area, that all of us should consider that we might be exposed, which means that we should all be getting tested regularly, and we should all be very careful about everything we're doing, from how much we travel outside our home, and if we do have to travel, who we're in contact with, wearing masks, careful hand washing, maintaining physical distancing. We all have to act like we quite possibly are exposed to COVID if we live and work in the Halifax area.
Next, we'll go to Keith Cochran from the Lighthouse Now.
Hello there. Just wondering, there's a population that has taken a position disputing the pandemic-associated science and corresponding public health protocols and public messaging. I'm just wondering what each of you can say to motivate this population to make different choices.
So, unfortunately, there's a small segment of the population which seems to be very resistant. I'm not going to focus a lot on them. What I'm going to do is focus on the vast majority of Nova Scotians, helping that majority of Nova Scotians to know what it is that they need to do, encourage and to support them to do the right thing.
Sorry, I was just gonna say they should read some peer-reviewed studies once in a while. It's not helpful because it does, I think, contribute to vaccine hesitancy, and it's super important that we get people out. And by and large, our data shows that most Nova Scotians, the vast majority of them, do want to go out and get their vaccine. So again, as Dr. Strang said, we do think most Nova Scotians understand the seriousness of this. That's how we were successful in beating the first and second wave. And we need to focus on making sure that everyone cooperates with public health protocols.
Go ahead, Keith, with your follow-up.
Yes, and that population is also taking their demonstrations to public parks. And just wondering if each of you were aware of the protests that happened on Saturday in Bridgewater and what you made of what you saw.
I didn't see anything, but if they're gathering, if they're breaking protocols, we'll make sure that the right enforcement's in place. It's selfish, frankly, if they don't care about their own selves, which they should. They should at least care about those that are close to them and their community. We now have people in their 20s, one person in their 20s in the ICUs. Look what's happening in other provinces. This is a deadly disease, and this time around, this variant is wreaking havoc in our neighboring provinces, and we need to make sure that we're stopping that spread, which is why we've strengthened these protocols. I know it's tough for some, but the vast majority of people at the same time are listening, so that does give Dr. Strang and I confidence.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, Dr. Strang. I have a question about people who have been vaccinated. I understand it's early days yet, but do we have any figures on how many of those people who have already received the shot have subsequently tested positive for COVID?
So that's a question we're asking, and there's a sort of national standard case definition on that. It's been looked at across the country. I'm only aware of one case so far that in Halifax of a person with 2 doses of vaccine who still became a case. We know from the literature that even if people that first of all that's going to happen on occasion. That the vaccine is not 100%. Often there may be some people with an underlying medical reason that they wouldn't get the full response to a vaccine like with other vaccines. But we also know that people, even if they're vaccinated and they get infected, they're much less likely to be infectious and be able to spread the virus in a meaningful way to others. But we are tracking that, and I'm only aware of the one case.
Go ahead, Tim, with your follow-up.
Yes, almost related, I guess. Some provinces have made the decision that people who have already had COVID, that have already tested positive for COVID in the past, will only receive one shot of vaccine. Have you and your team wrapped your head around that issue, and if so, what have you decided?
So we haven't, because fortunately, from wave 1 and 2, we've got a very small number of Nova Scotians who've been positive. So it's really not a number that we would, have an impact on our vaccine program, or that we feel that we need to pay, close attention to. If they get a second dose of vaccine, that's not going to impact our vaccine supply, and it's certainly not putting them at any risk by getting a second dose of vaccine. And there's a lot of unknown science on this, so I would argue that the best thing to do is make sure everybody gets 2 doses of vaccine.
Next, we'll go to Pat Healy from the Laker. Go ahead, Pat.
Hi, this question's for Dr. Strang or Premier Rankin. Many Mount Uniacke High School students go to Evanview High in Windsor. Do they go to school when their younger siblings can't go to Uniacke District?
So at this point in time, they are still able to go to that high school in Windsor. We'll continue to look at that and see if we need to make any changes there. But we have not seen any virus activity at this point in time in this current outbreak in that area.
Go ahead, Pat, if you have a follow-up.
All right, this follow-up is for Premier Rankin. Yesterday, you announced putting in a $2,000 fine. What options do the province have if they determine the $2,000 fine is not enough of a deterrent?
Yeah, it's a great question, Pat. I think we're trying to be somewhat reasonable with the fine amount, but doubling it we thought would send a strong message to those that we know were obviously flaunting the fine as if it didn't matter to them that they received a fine. But we don't want to focus as much on enforcement as we do the collective effort that we can all play our part, and I think that most Nova Scotians are doing that. And we did feel like we needed a little bit stronger of a deterrent. If we need to increase it again, we will, but we'll see how this goes so far.
Next, we'll go to Victoria Walton from the Coast. Go ahead, Victoria.
Thanks. We've heard from some pharmacists in the city and outside about having extra vaccines because of canceled appointments, and having even waiting lists of people who are under the age limit to get those vaccines. Is that something that the government is advising pharmacists to do? What should they be doing if there's appointments canceled? Like, is that permitted? Is that recommended? Dr. Strang?
So we're asking them to stay within the eligible groups, but at all our vaccine clinics, including pharmacies, we're making sure we have processes so that if there is vaccine at the end of the day or close to the end of the day, that for some reason somebody's missed an appointment or whatever, that they have a way to bring people in those eligible groups wherever possible to use that vaccine.
Go ahead, Victoria, with your follow-up.
Thanks. And I'm just wondering about the fines that were given out over the weekend. I mean, we've collected now, the province has at least $22,000 in fines. Is that money going in a specific fund? I guess this question would be for the Premier.
Not to my knowledge. Generally, fines that are administered in the province go to general revenue, and there's no specific fund that they go into. But as you know, we're spending significant money for COVID-related expenses. So it's just really a drop in the bucket for our revenue. It's not that we're trying to raise revenue. It's very much a deterrent for those select few that don't choose to follow the rules.
And that's all the time we have for questions. Go ahead, Premier.
Thank you. We've thrown a lot at you in the last 48 hours. Closures, restrictions, and reporting climbing caseloads. It's a lot to take in, and depending on your family's situation, a lot to manage. I want to thank you for working with us. You've come out in large numbers to get tested. You've stood out in the cold and the rain. You stood for more than an hour, and you don't even have a symptom. But you're doing your part to keep your loved ones safe. And I'm so grateful for your continued support in following the protocols. There's nothing more important to me as your Premier than the health and safety of all Nova Scotians. Dr. Strang and I and our teams will do everything we can to protect you. But as we've learned throughout each wave of the pandemic, we can't do it alone. So, as we face this third wave, the only way to outsmart this virus is to be smart and be strong and stick together. After all, we are stronger together.